all. This is Dr. Mobeen Sayed from drbeen.com. This is one more discussion for today. Welcome. And there are a number of folks. So welcome, everyone. So Jenna is here. Jenna, hope you are doing good. Steve is here. Welcome. DDS, welcome. Carolyn, present. Thank you very much. Emily, welcome. Amy, welcome. Steve, Jenna was first again. Yes, Jenna has been breaking the records of being first. Question, there was a question Carolyn had asked. So how am I doing? I'm doing good. So it is interesting, the difference between yesterday and now. I still have some nasal congestion, but that feeling of the energy drained from me, and I was on my bed by 3 o'clock. And even for yesterday's talk, I had to kind of drag myself out of the bed and convince myself to come out and go down and take a shower and get ready and prepare and draw and do the talk. Meaning it was an effort. It was a mental effort yesterday. Today, it was not that way. I still have some congestion. I do not have sore throat. You may actually still be able to hear some of the voice being a little husky or hoarse, but the congestion is not there in the throat area. The oxygen saturation was 98 throughout the day. So when I lie down, it would reduce, which is normal and natural. And then when I'll wake up or get up. So even now, it was 97, and this meter kind of fluctuates, and then it stabilizes and goes to 98. So it stayed 98 throughout the day, which is excellent. No fever, no lack of energy. I was fine. I was working with the team. I was thinking about the audit preparation, the documents that we need to do, the technical changes that we need to do, the content changes that we need to do. So all of that was fine. And so I was shocked to see the difference. One day I have skipped ivermectin. That was day before yesterday. Otherwise, I had taken ivermectin for the 3 days before. Then I skipped one day, and yesterday I was like beat up. And then I took ivermectin last night with many of the cool beans, even to the point, I think, Michelle, if you are here, that was the funniest one. Michelle says, "You're not a rhesus monkey that you're doing these experiments." I'm paraphrasing her tweet. And she said, "I want you to take ivermectin stat. That is nurse's orders." And I had already taken it. So Michelle, thank you very much. There was a beautiful note from France as well for the ivermectin. Everyone, Siddhartha and Siddhartha's messages, Margaret, there were so many cool beans, and there were so many messages insisting that just take ivermectin. And I had taken ivermectin, and night and day difference. You can actually tell the difference. I feel I have some congestion in the nose. And interesting thing is, the whole day I was fine, and the congestion started about an hour ago. I attribute that to ivermectin's half-life is 18 hours. So I attribute that to me taking the lower therapeutic dose of 150 microgram per kilogram body weight for myself. So I think that if I had increased, although half-life is still going to be the same, but maybe if I either divided the doses or increased the dose a little bit, I could create a coverage of this time as well. But generally, really good, doing good. So the reason I am talking so much about it is to kind of those folks who have been thinking about ivermectin, then thinking maybe is it useful, maybe not. Is it a placebo? Is it beneficial, not beneficial? For example, I have been talking with many cool bean doctors about my own situations to say, hey, what do you think? What should I do? And many of them say this is not even COVID. They simply think it is some cold. Some of them think it is COVID. Some of them don't believe in ivermectin. Even those cool bean doctors who are around me, some of them do not believe in ivermectin. Some of them believe in ivermectin. So those who do not believe in ivermectin had actually said that, hey, don't take ivermectin, just leave it, you'll recover. But The difference between yesterday and now is night and day. So if it is a placebo effect, I'll borrow Dr. Corey's message there that this is the best medicine, that is a placebo and still is 100% efficacious. So it has been very, very effective. And that is why I'm talking a lot about it, that whoever needs some convincing can see my yesterday's video and see what was my condition. You can actually tell from the video that I was drained and down and not my 100%. And you can probably see the difference today and the day before, and you can compare them to see how much of the difference was there. And that is the only difference in my medication. Other than that, I've been taking supplements. I was taking those yesterday as well. I've been taking anti-inflammatory. I was taking those yesterday as well. The only primary difference was ivermectin. And I also want to thank Arubaga. He lives very near, about 8 minutes from my home. And he had bromhexin. So I was able to, he actually gifted that to me. So I was actually go there and pick it up. So Arubaga, thank you very much for the bromhexin. Barbara says, we were ready to go find Dr. Corey. So glad you took the ivermectin and are better now. You have a great testimonial without having to share it from ICU. Absolutely. This is without. One question. So I know that France is here. I haven't seen Pasi for some days. Anybody in contact with him? I have not seen his comments for some days. I've not seen his comments here. I hope he's doing okay. Thank you. So Mr. J says, question, Canada is extending time between doses. Isn't it possible that suboptimal immunity provides environment for vaccine escaped variants, future variants that might be resistant to vaccine? No. With vaccine, even with one dose, you are actually better off than no dose at all. So your body is a little bit better. So it would actually fight better. So I would prefer both doses are done in the right time. But even when the second dose is not there, one dose is actually beneficial. Jan says, convincing experiment, Dr. Bean. And I know that so many cool beans had become so upset yesterday that I did that. And so my apologies for that. I would rather test something on myself than on the patients or someone else. You know that I'm a chicken for my patients. I do not take any risk with them. But I wanted to kind of see this for myself. Thank you. So JTJ says, question, can ivermectin work against the next virus that causes a pandemic? Does it have the right mechanism of action to work against other viruses? So interesting thing to note. Imagine at this time, the virus that is infecting me, it is definitely not a bacteria because I don't have fever that is spiking high up and I do not have pneumonia of that type. So it is all symptoms are of a viral so far upper respiratory tract infection. If it is COVID, SARS-CoV-2, then ivermectin has done a good job. If it is some other human coronavirus that is just sitting in our throat forever, then ivermectin would do a good job against them as well. But if it is something else, then ivermectin is actually proving beneficial for the other one too. The question that is not answered, number one, am I really COVID positive or not? The test said no. I should do a retesting or probably do antibodies. If we assume it is COVID, then ivermectin is just doing its job, and we do not know what will it do with the other viruses unless these are RDRP positive or are 3-chymotrypsin-like enzyme positive viruses. If it is some other virus, then whatever virus it is, ivermectin is doing a great job. Now, it is also possible that ivermectin is actually doing nothing for the virus. And ivermectin is only helping reduce the inflammation, which is even more potent than ibuprofen. And I would really not think that ivermectin's anti-inflammatory mechanism is stronger than ibuprofen. So I would still think that it is interfering with the virus somewhere. So the short answer is, it may be that it would be helpful. Roberto says, happy you're doing better. I send all my love to you. Thank you very much. And love back to you as well. France says, Dr. Bean, Denise TG, Denise has an excellent suggestion. Did you give the cats prophylaxis? I use ivermectin with my parrot for years when her voice gets hoarse. I have not, but I think I should go to the veterinary clinic and get them ivermectin. I would do that. That's a good idea. Thank you. This is a loaded question for me. Angel, what do you think of the Texas governor removing mask mandates and reopening businesses to 100% capacity? So I saw some folks on Twitter actually sending me those and saying, hey, yeah, this is great news. Some sending me the same tweets and saying, well, what a wrong thing he's done. So I'll just put, without saying that politically he did the right thing or wrong thing, I think we should look at it from a scientific and medical point of view. So it is unfortunate that in this country we have developed two very strong corners. One corner says there is no benefit of masks. Other says there is. I am in the group. Unfortunately, I am in the group that is strongly proponent of masks. So decision, I kept thinking about it, that how come a person arrive at a decision where they may actually expose people to the point of them dying and still be okay with it. So that means they have to be very convinced that this all is not going to happen and masks are useless. And then they're so convinced to say, yeah, this is not going to cause any death, and so this is okay. So I do not know what kind of evidence they have in their mind, but this can be dangerous. Just like Lima in Peru, I think it would also be interesting to now look at how Texas is going to operate. And the cases there, just like Switzerland, just like, Sweden, just like Lima. So we'll see. Maybe there is some science in there which we are not aware of. So Andrew says, I've been reading about some isolated COVID cases causing acute disseminated encephalomyelitis. Is this a secondary infection or the result of COVID inflammation? This is inflammation. So somehow the inflammatory system, the cytokines, the cells, the antibodies, something is going into the brain tissue or to the meninges and causing inflammation, which is then causing these reactions. Mr. J says, do you wear a mask outside and do you still maintain distance when masked? Yes, very, very religiously. I wear a mask. I have many masks in my car so that even if I forget, sometimes what I do is I wear a mask and I forget to take it off and I keep it on my face and I enter my home and I bring it in. And then I have a box in my car so I can go and get the other one if the other one is at home. So yes. Denise says, figures Machiavelli, shaking my head, Dr. Drew, get some doozies. Yeah, I have actually asked Dr. Drew to join us. We're working with his team. Poor masks are subject to tremendous projection. And Gold Country says, maybe Kelly should replace Governor Newsom with Texan. Maybe. I am not a no mask person. So CC says, this is a curious question. Would ivermectin work on a common cold virus? I'm happy you're better. Glad you took ivermectin. I'm a fairly new bean and we learned so much from you. So the important thing is that it will work, at least from the mechanism so far that we have observed. It will work against any virus that works with the ACE2, and ivermectin can interfere with that, or any virus that uses RDRP, or any viruses that use 3-chymotrypsin-like enzyme, or any virus that are going to use important alpha and beta. So there are many viruses that use RDRP. So it can become useful for those. Micabelli says Brazil is a petri dish of mutants, unfortunately. Janine says, is that what fluvoxamine will help with? Yes. So fluvoxamine, because it can cross the blood-brain barrier, it can go into the brain and then help with the brain tissues functionality, and especially the serotonin's balances. That is why fluvoxamine is helpful. Yes. M. Gregory says Sweden wears no mask. So they have paid their price. Brice says, does not wearing a mask lowers the oxygen level, and isn't that important? No, not at all. So please realize this, that doctors have been wearing masks for ages, and the masks are mandatory in surgical theaters, and doctors can continue to work for hours and hours in the theater and no issues. Wearing a mask, so if you think about it, let's say this is the mask. Mask's job is not to filter out oxygen. And when we inhale, we bring in about 500 milliliter of air. Out of that 500 milliliter, about 150 milliliter of air stays in the respiratory non-oxygenating pieces. That is, for example, the air in my mouth is not taking part in oxygen or carbon dioxide or gas exchange, as we call it. So mouth, nose, pharynx, larynx, tracheas, airway, big airways, the air that is stuck there is not doing any exchange. About 350 milliliter ends up in the alveoli. Out of that, there is some part, not all of it, there is some part that mixes with the already present air there and then does the exchange. Fortunately, our blood in the lungs is sufficient to be able to extract as much oxygen as needed. Many times we don't extract a lot of oxygen because we don't need that. So when you are using mask, you are not really reducing the oxygen supply in the lungs. You are still bringing in it. Let's say the only problem with the mask is that if I have it, my breathing in is slightly slower, let's say, because there is some resistance here, right? Even then, if you go to the pulmonary function tests and if you do this, you would see that it is still 500 milliliter. The effort of breathing may have increased depending upon what kind of a mask it is. And the mask should not be such material that kind of hinders or blocks the breathing, because that is really choking us. Now, if that is the case, the oxygen is going in and we would breathe fine. When the oxygen comes out, or the gases, carbon dioxide comes out, again, this is just a very thin thing. It cannot trap carbon dioxide in it in significant quantities. Neither can it cause the carbon dioxide to stay behind it. The 150 milliliter that is going to stay here is going to stay here. So there is no mechanism. Forget about science. There is no mechanism in this whole process of wearing a mask that should somehow cause more carbon dioxide to accumulate and less oxygen to go in. So Brice, no, that is not possible from a mechanism point of view. So, Simple Garden, I hear so much about people feeling hindered. Maybe having worked in a hospital for so long made it a nuisance for me. I forget I even have it on. That is what happens to me as well. And it is very interesting. I sometimes become very aware that I have a mask on, and then it starts annoying me. And many times I don't even care, and I have the mask on and I'm walking, or I am out, and I forget about it and it just is fine. Rosie says, is it safe for me to sneeze and cough into my mask? So the thing is this, sneezing and coughing will bring up some of the bigger particles that can be lodged in the mask, and the mask could become useless because it would become blocked. 1x2 says, now we know how ivermectin works. What other diseases could it be used for in the future, maybe even cancers? So they have been trying ivermectin for leukemia and other cancers as well. So yes. Jenna says, ivermectin doesn't cause chelation, true or false? I haven't heard that ivermectin could cause chelation. Chelation is usually caused by those substances that have metals in them, and they can then chelate. Ivermectin doesn't have metal, at least as far as I know. Doug says, question, is the spike protein a homotrimer or heterotrimer? I think it is a heterotrimer because all the three pieces, the S1, S2, and the RBD, one more part, which is I think it is the RBD part, they're all different. So Simple Steve says, read that the RBD protein of SARS-CoV-2 has a strong preference for binding to the blood group A on the respiratory cells. So it would seem that blood type is important for resistance to COVID. That's actually not correct. The basic problem was that the blood group O had less factor VIII, which allowed them to have a little more inclination towards more thin blood. And so they responded less to the SARS-CoV-2 generated cytokine storm because they had a natural tendency to be less hypercoagulable. So that was the basic problem. And I have done a talk about that. Denise says, he's quite good, Cher, thankfully. Yes, so Cher, if it is about me, I am doing much better. I do have some congestion. I think the skip that I did, the dose, that did allow whatever is here to multiply a little more. So I do have some congestion, but I feel fine and I am doing okay. And I kept talking with the doctors because, again, fingers crossed, this is such a weird virus that we do not know how would it progress. But so far now it is a day 5. If it is COVID, usually if somebody was going to go down, the progression or deterioration occurs within 24 to 48 hours, and it goes down very fast, and oxygenation goes down. And the way I'm talking with you right now, I'm sure that many medicos would say it. People cannot even articulate one sentence completely without stopping and breathing. So at least from the symptoms point of view, it seems like there is not much deterioration, except yesterday when I had skipped ivermectin, and yesterday there was a noticeable decline. And then I took the ivermectin. I haven't seen a recovery back to the day before yesterday. My nose is still congested, but generally I am fine. My energy levels are fine. I do not have fever. I'm not sleepy. I don't want to go and just lie down. I'm speaking with you, and I'm inside somewhere in my head is not this feeling that I need to go and sleep. So generally it looks fine. So thank you very much. And again, it's not that I am just loving talking about myself. I'm saying this so that those who may use ivermectin at some point, there may be some evidence here that there is a benefit of ivermectin. Andrew says, has there been any benefit found in IL-6 or tumor necrosis factor alpha inhibitors in COVID cases? So first of all, TNF alpha should not be inhibited to a point that it becomes too low. But yeah, generally we need it. Tocilizumab is still being used. I do not know if there has been a lot of benefit shown. Colin says, can wearing a mask heighten your likelihood to rebreathe other microbes even aside from COVID-19? Something that is coming out of you, rebreathing is going to do nothing. So let's talk about COVID for a second. The COVID, imagine the very first day when it arrives in us, a tiny amount, and then see how rapidly it increases. Now, out of all that millions of cells in which it is making millions of copies and then increasing and coming out, let's say a tiny amount is here. that even if we rebreathe, although the one that gets stuck here would not be rebreathed, but let's say some of it goes back, that is nothing. It's not even significant compared to the amount of virus present. Even in one cell, the amount of virus that is present is a lot. We did that math one day. Remember, there is a video I did that how long cells will continue to produce spike protein, in where we talked about it that every cell has about 10 million ribosomes. And if all of them are churning together, within a few hours, they would all make a new spike protein or a set of spike proteins. So within a few hours, 10 million spike proteins or viruses. And then they do it again, and then they do it again. And so just one cell would produce millions and millions of copies. So this is quite insignificant for a person who is already infected. For a person who is not infected, for them to get this little dose for a few minutes is then sufficient for them to have enough load that this virus spreads. So not a big deal. Jim says, nebulized H2O2 with Lugol's iodine was effective for me, 63 years old, asthmatic, no respiratory problems. Excellent. So many questions. Cynthia says, Dr. Bean, I thought you were talking ivermectin prophylactically. I have been taking since January. So I was not taking it prophylactically. And my doctor was just not giving it to me. So finally I got it. But interesting that as I started prophylaxis, I developed these symptoms as well. And so that prophylaxis just got converted into management. So Joe B says, would ivermectin be effective against dengue? Maybe some of the same mechanism, maybe. So I have to kind of look up the mechanisms and match them. Doug says, what are the ground glass infiltrates on CT mechanism? So let me very quickly share this or draw this. So what happens is, normally, so the medical folks, so Luffy is here. Hey, Luffy. So let's say these are the lungs. What happens is inside the lungs, we have these things keep branching and they branch and branch and branch. And finally, we have alveoli or something like this. We have airways, which finally become little balloon-like structures where the oxygen exchange or gas exchange occurs. Outside of these is the connective tissue. Inside of these is a fluid layer called surfactant, and then empty space with some cells in them, and this is the gas exchange area. And then nearby is the blood vessel. So the oxygen's job is to arrive in here, then cross all of this and end up in the blood, and then sit in a red blood cell, and then go to our tissue and become available. Carbon dioxide's job is to come right on the cell RBC or in the blood, and then arrive here, and then from here they cross all of this barrier and then go out and get out. So that is carbon dioxide. The ground glass infiltrate, usually viruses cause something that we say atypical pneumonia or walking pneumonia. What that means is that patient is not aware that I have damage going on, and they are just walking and saying, I'm fine, just like I'm saying I'm fine, and they still have the damage going on. So the reason for that is that the damage is actually occurring outside of the alveoli, most of the time in the interstitial area, this area between the blood vessel and the alveoli. This is called connective tissue, and this is called interstitial area. This area is where the damage is occurring, and we call it atypical pneumonia. In case of SARS-CoV-2, it starts with the atypical pneumonia and then it becomes typical. Typical pneumonia means it would break down the alveoli and then it would actually cause lots of damage inside the alveoli as well. And they would fill up with the fluids and congested material or pus-like thing, which, as that day Dr. Corey was talking about, it could become organized. Organized mean that pus would just become solid over there. And now that alveolus as the part of the lung is destroyed forever. Or it could become resolved. And in resolved state, what would happen is the macrophages would come around and they would just eat all of this up and restore the normal balance here. That is a resolved pneumonia. Now, the ground glass appearance occurs when this atypical pneumonia starts and those initial infiltrates occur. That appears as ground glass opacities, or this material accumulation here appears on the chest X-ray as the ground glass, chest X-ray or CT scans. Simple Steve is saying, where the heck is Luffy? So Luffy's on the other side of this door. He has his scratching post over there. So he's scratching and then he's meowing from there. I'm sure that in a few minutes he would come around from the other door. Mopip says, do you think vaccine will stop you getting COVID-19, or will everyone still get COVID-19 and still be able to infect others? So we have done this discussion in the past as well. Vaccine has no way of stopping you from getting the virus in your mouth, nose, or eyes. Once the virus is in here, if you have a vaccine, what we'll do is this: we will immediately, the immunoglobulin A that are present in the mucous membranes here, they would kind of immediately bind with the virus. And now the virus is stuck with the, imagine in the US here, there are car boots. So when police is, there is a car that they do not have the license renewed or the car's plates renewed, and or there is a challan that they have not, ticket they have not done, then the police can come in and they can just put a boot on the car's tire and the car cannot run anymore because there is a lock on it. The same thing is the case that would happen with the what is that, the SARS-CoV-2. Now the IgAs are stuck to it like a boot on the car, and now this thing, the virus cannot really run around, do its things. It cannot bind easily to the cells and go in. So even if we then eject it back without breathing, it's going to go to other ones with the IgAs stuck on it and kind of coated with that, and not very useful. Other thing is that when the virus arrives in our mucous membranes, of course, we have very rich lymphatic materials over here, and they have cytotoxic cells, they have memory B cells, they have neutrophils, macrophages. So these would attack it as well. So ideally, it can take up to 24 hours, this kind of a response. During that time, virus can increase a little bit and then be ejected from our mouth as well. So I think, so this is my opinion part, I think that we would still be able to get it, which is called infection, and then transmit it to others as well. Maybe not in the high enough load, but still transmit it. And some people might actually become infected by that. Mark says to go toward Luffy's hello Paradol. Will do. Thank you. So this is a very good question. Roberto says, why don't you try steroids since you are in day 5, 6 of the disease? Yes. So now I am, I think, at a stage where steroids can be used. So tomorrow I'm going to look at my situation and then decide to take that low dose therapy of steroids. So Rima says, I'm a PA. I am in PA. I think Dr. Heather in New York will RX via telemedicine, target carriers. It is in my pro. So I have done a video called Doctors Prescribing Ivermectin. And there are so many folks who have been asking me that who are the doctors who can prescribe. So please, doctors prescribing ivermectin is the video, maybe 5-6 videos down this list of videos in my channel, where I have discussed who are the doctors. If you don't want to watch the video, then please go to flccc.net. They have a list as well of the doctors who are prescribing ivermectin. Some of them prescribe ivermectin throughout US, some prescribe in some select states. The other thing is, it is so unfortunate that ivermectin from UK cool beans have been looking for ivermectin everywhere, and somehow their healthcare system does not allow the doctors to do it for the way they are structured. Same is the case for Canada as well. So I feel bad about it. And so many folks keep asking me that, hey, what do we do if we are in UK or Canada? And I truly do not know what is the right answer. So if somebody knows how to help folks in UK or Canada and how to get them ivermectin, or what is their mechanism that helps, just like we have here now for US, then please help us understand that. Harish Deepak says, why don't the drug companies launch ivermectin with a new name and with new price tag? Such cheap drug therapy for such a deadly disease is unacceptable at WHO. I don't think that even drug companies care that much. They don't care. It doesn't make them money. William says, I took the Moderna shot yesterday, 10 a.m., had a severe headache. I tried not to take ibuprofen for pain, but at 1 a.m., I gave in and took Motrin for pain. Did I decrease the vaccine efficacy? No. So we have done this discussion. I think just like ivermectin, I should do this discussion separately as well. Let me actually explain this, William, with the mechanism, because this is a very common question as well. So let's see. Look, what happens is, when we have a vaccine, so let's start from here. Let's say this is a dendritic cell, and here is a vaccine, adenovirus, inactivated virus, or lipid nanoparticle. And the vaccine ended up here. Hey, Luffy. So what are you doing, Luffy? So here is Luffy. Luffy, what were you doing? Luffy. What were you doing? Look in the camera over there. So Luffy would tear up all of my dresses because he has those nails, and he would just dig in and pull the threads. Okay, so back here, so let's say this is the virus, lipid nanoparticle or inactivated virus or adenovirus. Eventually, it is going to cause some spike proteins to be formed. Correct? So those spike proteins would then be shredded by endosomes. And finally, my apologies for Luffy's noises. And then finally, it would be presented on the cell surface, either with MSC1 or 2, and that would then cause naive T cell to be engaged or cytotoxic T cell to be engaged, depending upon MSC1 or 2. Then we know that there will be T helper 2 or T helper 1 pathway. And then finally, we'll have a B cell becoming a plasma cell. And then either we'll have antibodies. I shouldn't say either. Either we'll have dominantly antibody production or dominantly cytotoxic T cell. There will be both responses, cytotoxic T cell and that. Now, with this response, there is an additional factor. So this is immune system response. There is an additional factor. All those cytokines that are being generated, and then these antibodies that are generated, these antibodies would then bind with these antigens, and then these complexes would connect with macrophages and other cells. And so there is a second response from the immune cell and the other cells, which is inflammatory. For example, we also know that some of these cells that are presenting the vaccine or the pieces of the RNA spike protein, these will be killed by the natural killer cells or the cytotoxic cells or the macrophages, and their pieces are going to be broken pieces. These are the damaged pieces. So there are cells that have damage associated pattern matching or DAMPs. All of that would actually result in inflammatory pathways to kick in. Inflammatory pathways are the prostaglandin and prostacyclin and leukotriene pathways. And we have done a discussion about that in detail. If you wanted to watch that, I have a video called titled Aspirin. And so if you go to that one, in there, I have discussed this mechanism in detail. So the inflammatory mechanisms kick in. They would produce prostaglandins, leukotrienes, prostacyclins, and the result is there will be pain. Pain occurs because the nerve endings get tingled or tickled by the prostaglandins and histamines and other things. There will be swelling. Swelling is because the blood vessels in that area become swollen or kind of dilated, not swollen, dilated, which would then allow various substances to exudate outwards or come out of the blood vessel and kind of accumulate in this area. That would cause swelling. And so there is pain, there is swelling, and then there is redness. There is redness because the blood vessels to that area have become dilated and there is more blood that is coming in. This is just like blushing. So some people blush, right? So when they become embarrassed, or when there is some sexual interaction, or there are many reasons, then people blush. And what is blushing? The basic mechanism, the blood vessels, they dilate and more blood comes in and we can see that blood. Same is the truth here, that when more blood is coming in, that causes this area to become red as well. This is inflammation. The drugs that we're talking about, for example, ibuprofen or aspirin or other such things, many of these drugs would actually block the inflammatory pathway. Inflammatory pathway has little to do with the immune system's training. This training is independent of you feeling pain or not. Pain and swelling, and that is just to tell you that there is something going on. So if you have taken a painkiller, that has taken care of this part of the response of your body, but has not stopped this part. Now, let me qualify this. If you take steroids can actually block all of this, plus block this. So the person may not have inflammation, so that is anti-inflammatory, plus they would not have good immune response, or they would have immunosuppression. So if you use steroids as anti-inflammatory, then immune system is going down as well. But if you're using NSAIDs, non-steroidal anti-inflammatory, they usually do not cause the immune response part to be modulated. How are you doing, Luffy? What happened? So I hope that answers that question. Luffy. Michael John Music says, how are we supposed to know all this? Michael, are you talking about these mechanisms or something else? France says, Luffy is asking if you took your ivermectin today. I speak cat. He's actually standing right here. So hopefully I would have my ivermectin after this. So that is what I have been doing. Son Dang says, you mentioned in another video that viruses are not alive, so they cannot die. Are viruses the same as exosomes? So that's their exosomes are simply, you can call some viruses, or prions are more closer to exosomes. Viruses usually have RNA and some more structures around them. When I say they cannot die or they cannot look, we make them inactivated. We make them unviable or non-viable. So we can still reduce their replication and spread. let's call them dying. The virus is death. But in general, they do not have a life form like others have. So Bush says, what about the fever part? So again, the fever part is also part of inflammation. So what happens is when the inflammatory system kicks in, then part of that is the release of interleukin 1 and 2 and 6 and so on. Those interleukins, they cause fever. And so, for example, if you have taken antipyretic, you have really just blocked the interleukin 1 and 2. Those interleukins especially cause fever, and they are not really helping in case of a vaccine. In case of viruses and bacteria, fever actually helps our cells to be able to kill the virus or bacteria in a more efficient way. Our virus and bacteria are killed better in higher temperatures. So Simple Garden is saying, Amy Reynolds, are you looking for a doctor who will prescribe ivermectin? Go to the... So let me just very quickly show this. So if I go here, and everyone, I have done a complete talk separately about it. But if you go to flccc.net, there, if you go to this iMask Plus protocol, here, information to share with your doctor. If you go there, hey Luffy, what are you doing? So in here, do you see this little line? It is just one line, and so it is quite inconspicuous. It is actually not. Is it inconspicuous or or not? Anyways, this here you can just easily miss it. But if you click this, it opens up this table, and in here there are various doctors. For example, if you see here, Dr. Elietta Eck, all over the US. So if you reach out to her, here is her email and the phone number. Jim Maheen, Richard. I have personally talked with Dr. Sayed Heather. I have talked with Text to MD. Although I feel that Text to MD, some folks responded back, and I've been talking with them as well to say that they are taking some time to respond back. And I can understand. Imagine the whole US or people who are aware of the ivermectin, they have these 10, 12 doctors to go to. And because of that, there is a lot of pressure on these doctors as well. It is unfortunate that we do not have enough number of doctors who are doing this, but at least you can go to this site and you can see them here. Dr. Griffbean says, I like in a Griffbean. Did you all know that cats don't generally mew at other cats? They mainly vocalize solely to their owners. I watched a research video on it, and it was crazy. This is actually very interesting. We have a stray cat that has kind of adapted as she always is outside here. And we feed her daily, morning and evening. And she loves to play so much. So, and I was so surprised for the power of love that when we go out to get her food, so now on one end she has food, and then on the other end she has a human being to interact with. So she leaves the food, she runs after us, and she does this paw thingy to get her scratches. So we usually go out with a glove, and so we scratch her and kind of play with her, and then after playing, she would then go back to the food. So she leaves the food to do the play, and at that time she mews as well. So that is interesting. I haven't seen her mewing otherwise. So interesting. And thank you very much for the super chats. Barbara says Luffy has a girlfriend. So Luffy has Kyrie as well. Amy says, I don't want to buy you coffee anymore because I don't want you to get sick again. Glad you're on the mend. Thank you very much, Amy. Uh, Logic. Dr. Bean Medical Lectures. What would happen if someone is extremely malnourished and received the messenger RNA vaccine? Would their body be more inclined to overreact? Would efficacy be reduced? So, no. So, somebody who is malnourished, think about it this way: all of our cells, they need energy to function, including immune cells. T cells, B cells, macrophages, neutrophils, they all need ATP to function. Now, if somebody is malnourished, they do not have enough ATP. And because they do not have enough energy, their cells are not actually going to function. So they are like immunosuppressed. Their immune system is not overactive, it is actually underactive because it's just not working. So if you vaccinate them, their immune response will be less. That doesn't mean not to vaccinate them. And I would suggest to offer some glucose or juices or water plus juices or other things to have some energy in the cells and have them functioning. But they are usually more immunosuppressed. This is the same situation with diabetics as well. Diabetics is a problem where we say this is starvation or hunger in abundance. So glucose is present everywhere in the body, but is not going in the cells where it is needed to make energy. So uncontrolled diabetics have immune system that is also not functioning correctly. So it is similar to immunosuppression. This is why diabetic patients, again, uncontrolled diabetes patients, have infections very commonly, or their wounds do not heal correctly because their immune and inflammatory systems are not working correctly. I hope that answers this question. Letitia says, "You are the coolest. Thank you for your show. You are teaching and we are learning." Thank you very much. I love it that we spend time together and discuss things. Murugadas says, "How does a researcher decide the interval between the two doses of the vaccine?" This is total thought on their end to say, why not do this and see what happens? Of course, the basic thinking under the hood is that it takes 7 days to 14 days or more for the immune systems to become activated. Remember, innate immune system, that is the neutrophils, natural killer cells, macrophages, these cells will become active within 24 hours. They become active right away. But then they have to activate the adaptive arm, and adaptive arm activation can take many, many days. So a safe time is about a month away. So I think what they're doing is that they're saying, okay, give the first dose and then wait for a month, because we are sure that within a month, everybody's immune system would have reacted and would have created memory cells and would have created memory T cells and helper T cell memory cells and so on. That means some people's immune system may have created memory cells within 7 days. Others may have it on 29 days or 30 days. Some people even later. So then if you give a dose after 30 days, you are sure that in majority of the people, immune system has become fully aware, and now giving the second dose would create a boosting behavior or kind of bother it again and cause those memory cells to wake up and say, what the heck is going on, and then respond to them, increase in number and become more efficient and become more affinity matured, and that would make them even better. So I think that is why they kept 30 days in it. Chuck Becker says, Luffy is hitting the high notes. Yeah, so he's finally gone. He has done his, he has sang his people's songs and now he's gone. Steve says, in the future, we need a vaccine force like an extra branch of military, paid volunteers who will go into a phase 3 study the instant a new pandemic arises and there's a new vaccine to try on it. Yes. James says, is Dr. Seuss okay for kids or not? So I had always read Dr. Seuss, but I don't know. We are becoming very touchy as well. And then there are things from our past which are not a match for this time. Just like there are things from hundreds of years ago which are not a match for this time. For example, they used to burn people, or they used to do things which are not possible or which are not even decent now. So times do change. So maybe this is a reflection of changing time in a good way. I try to just keep myself very focused on the medical side, concept side, and Dr. Bean's business side. Papa says, Dr. Bean, please tell us about skin hives, etc., dermatology, sign symptom with COVID. Can ivermectin reduce the hive symptoms? So give me for asking so much. I'm really curious. So so far, what we know with the COVID is the skin effects that we are seeing are usually because of the hypercoagulability of the blood vessels, or blood vessel incorrect functioning, causing the blood to accumulate or to swell under some areas. So that is what we are seeing. We are seeing COVID toes as well, which is a similar mechanism of hypercoagulability. We haven't seen yet allergic type behavior causing skin things with SARS-CoV-2 only. It could be because of the medication that is being given, but not directly because of the SARS-CoV. But blood vessel change in functioning can cause skin behavior. Now, can ivermectin fix that? No, because it is not a scabies-like situation. It is a inflammatory situation. Will ivermectin reduce it? Maybe. Will we need other anti-inflammatories? Yes. Will we also need hypocoagulable or what is that? The blood thinners? Yes. Would we need some drugs like antihistamines? Maybe. So there would be other drugs, but I don't think ivermectin will help a lot. So Texan MD has been very, very useful. So I have been Dr. Antonato's, I have been talking with him. The only thing, and I would actually reach out to him and kind of tell him maybe it is important. The only thing is that some folks have sent me a message that, hey, it takes too much time for them to respond. So I want to talk with him to say, is it possible that their response becomes a little faster? So okay to let go. Can you talk about the debris that Dr. Paul Marik speaks of and its relation to the cytokine storm, please? So very simple. If I draw this for a second. What Dr. Paul Marik is saying is that, let's say there is a cell here. In the beginning, the cell gets infected with the virus. And then the virus increases in number, and then this cell has many fates. It is possible that the cell survives, the viruses eject, they go and infect other cells, and then they continue doing that. It is also possible that when the viruses are too many in number and they come out of the cell, they destroy the cell on the way. It is also possible that some natural killer cell comes over, sees that this cell is infected, and it is not expressing its cluster of designations or CDs correctly, and it kills it. Or a macrophage comes in and kills it, or another cytotoxic T cell comes in and kills. So there are many fates for this cell. One of the fate that Dr. Marik talks about, and that is more commonly possible for the macrophages and the neutrophils, is that they have eaten the virus and they have shredded it, they have broken it down into smaller pieces, and they've kept it in themselves. And now this broken pieces of the virus are still sitting in the cells. This is the debris. Now, it is possible that this debris is also eaten up when this cell dies. the debris is leaked out in the tissue interstitial area, which then macrophages come and eat this as well. So this debris may sit in the cells for beyond 7 days. And this debris then continues to bother the immune system. Now, the virus is not there, it is not replicating, but for immune system, there is some foreign thing that is still sitting there, and immune system just continues to respond to that and keeps going mad and mad and mad. That is his theory for the macrophage activation syndrome. Bob says, no, Dr. Antonatos is great. Yeah, so he's awesome. He has been talking with me a lot. I really like his work. I think he's overwhelmed at this time. He has too many. He actually reached out and he said, thank you, since you've talked about me, there are so many people who have reached out. His site, somebody was saying me that they cannot reach his site. Look, if you go to, and I have no interest with any of the doctors here. So if you go to this place, text2md.com, right at the top here, call or text us. You can send a text on this number, and I think very soon, he himself is, I believe, in New Jersey. So according to his time zone, at some point, he is open 24 hours through this phone. And so he would respond, and then he'll talk with you, and he will offer you prescription. Nancy says, Dr. Bean, so the spike proteins in the virus could also cause neurological problems when they cross the blood-brain barrier. What are your thoughts on that? I have done this talk once before as well. There was a study which showed that the spike protein can cross blood-brain barrier. Now the question is this: can the virus, actual live virus, cause the spike proteins to be produced in big enough number, then to be present in the cell, and then just be the spike protein? That is like saying that can we have so many dead bodies of the virus and just the hands, spikes, are severed, and just the hands are running around in the blood, and then they're crossing the blood-brain barrier? I think somebody who is dying of this issue, they may have the whole viruses or parts of viruses in the brain as well. Somebody who is resisting it and staying alive, they may not have a chance for the spike proteins to enter the brain in big enough volumes, but maybe. At least there is a study that says spike protein alone can cross the blood-brain barrier in rats. But question is, can we have spike proteins alone? Because as soon as, let's say we kill, let me share my screen. So let's say we have actually killed, James says, do you advise aspirin before? So that's a COX-2 inhibitor, anti-inflammatory. Yes, it's fine. So if, let's say these are all cells, this cell died. And when this died, when it was broken open by a natural killer cell or a cytotoxic cell, it released a lot of SARS-CoV-2s. Some of them were fully formed, some of them were still being made. And so those SARS-CoV-2 and then some spike proteins, some RNA proteins, some N proteins, M proteins were all released out. These things cannot just very easily go into the blood and start running around because we have macrophages sitting here. These are immediately going to start eating these things up and digest them and take them away. So it's not that these things would just simply enter the blood and then from there go to the blood-brain barrier and then get into the brain. But will some of these do it? Yes. Can they be significant enough to cause an issue? Maybe. That is not known. So Amy says that text to MD was very fast today. Excellent. So I think I should call him and say him thank you. I had actually said to Dr. Antonatos, I said, I will watch how you're performing with the cool beans because they are in need. So good if he is doing good. Excellent. And he's doing a great service. Mr. J says, uh, have you done a talk about possible origin conspiracies, or is that a YouTube flag waiting? No, so I did not. And yes, it could be a YouTube flag. How many worldwide deaths following vaccination till now? I have not looked at those. My whole last week was on for long haulers. This week I started talking about ivermectin. I started talking about my own situation and ivermectin. So I haven't yet raised my head and looked around. So I would do that. Bert says, can't see my question. Bert, what is your question? Let's see if I can go find it. Bert, I cannot see your questions earlier. Maybe if you can write it again. Barbara says, Stuka, he has certainly debunked. There are so many theories. Somebody sent me a video note today where the every speaker in there was just some weird theory, and I was watching that and I was saying, how would I respond to all of them? Every sentence was a theory. Josh says, how high is the risk of transverse myelitis Guillain-Barré for those who decide to get the vaccine, who currently have had those conditions? So, Josh, interestingly, those who already have the condition, there is no correlation directly that gets aggravated. But what is happening is that those who have it or those who do not have it, it is kind of causing that to many. Now, I haven't seen the exact percentage, but even today, before this talk, I was watching a video where a woman had gotten Moderna and then she had developed fits, and she was not even able to control herself, and she was just continuously had those jerky movements. What I do not know is she on the improvement or not? Ideally, these things should be temporary, but there is a lots of concern there. I need to do some more data digging. Navinath Vishnu says, good evening, Doctor. Doctor, could you please explain the effect of neutrophils to lymphocyte ratio in patients with COVID-19? So what happens is, in the beginning, somehow this ratio gets disturbed. That is one of the labs that we look for. Now, realize it this way. Forget about the ratio itself meaning something. See this, that when we say the ratio disturbance is a good marker to say this may be COVID. But now what happens if, let's say, the neutrophils are reduced? Neutrophil reduction means innate arm becoming weak. If lymphocytes are reduced, that means the adaptive arm becoming weaker. So normally their ratio imbalance means one arm is getting hit by the virus and is being destroyed, and so that ratio is not maintained. So this is a flag that one arm of our immune system has become weak because of the virus attack. France is here. Hey, France. We have to see where Pasi is. I had become so used to having Pasi, France. Sorry, Japan is here. I called Japan France. Hey, Japan. Japan and Margaret, Jenna, Cher, Michelle. So there are so many. So please don't be upset. I can keep naming names. For example, today I'm not seeing Samina here. Barbara has been here for a very long time as well. Jenna says, came back oxygen 78 to 85%, but pulse high 90s. Whose is this number? Chuck Becker says, Dr. Bean, thanks for creating this fun environment with us. Most welcome. So I'll tell you how I feel about this. I am originally from Pakistan, and in our rural areas, and I think this is true for India as well, in our rural areas, uh, in the evenings, people, there is a common building, and the weather is not very harsh in Punjab type states. So in the evening there is a big building which we say Chopal, I think, and over there the youngsters and the elderly and they all gather together and they have little candles, which that they light up and they sit down and there are stars up in the sky and they sing songs and they tell stories and they just talk about their day and they interact and they become happy and then afterwards they go home. Uh, and I have never attended one of those, but I always used to get very fascinated with that idea of these these meetings where friends sit together and in the evenings and talk things and discuss things. For me, this has become that little forum where we sit down together, friends, we talk about things and we discuss them. And somebody says, hey, how about this? And somebody says, how about that? And then we talk with each other. I see such a healthy discussion within the cool beans as well. And so I am kind of, you're correct, it is a very fun environment. France says 145 lazy beans report for smashing. There are 484 people who are online right now. Um, Papa says, Dr. Bean, would you be taking vitamin K, cause more clotting if I take it and get COVID infection or histamine flares? So vitamin K2 with vitamin D. I do not take K. This is correct. Trevor says occasional trolls. Yes. Okay. In the the history over 1 year, we are almost reaching 1 year time now. The history is that in the beginning there were people who were very upset. They were not expecting someone like me to come in and talk, and then talk about COVID, and then offer things that go against. For example, we talked about hydroxy and other things. So then there were, in the beginning, there were people who would threaten me and who would say, we'll get you in jail and we'll get your license cancelled. And once the pandemic is over, we're going to come after you. And there were things like that. And in the beginning, I became scared. Then that went away. Then slowly those folks uh, were replaced with another bunch who would start reporting these videos to YouTube and get them down. And so I would have to appeal them. Some of those are still not up, and some YouTube will put them back. But now, recently there has been no appeal for any of our discussions, although there are many ivermectin discussions. Then we started having trolls as well, who would just come in and say, mask, what about masks? Or there is no virus, or the virus has never been seen, or this is all a 5G theory issue, or others. And then slowly they started going away as well. And so I think there was a big filter in a year, and the community surfaced from all of those occasional trolls and angry folks. And now here we are learning and discussing and having fun together. I actually think that during this whole year, if we didn't have these tiny discussions daily, we would have been so, at least I would have been so lost that what do I do? JMT Hero says, can a lysosome present in a saliva or any mucosal layer in our body can also help fight against SARS-CoV-2 since lysosome is part of the innate arm? Yes. So part of innate arm, there are many proteins as well. So lysosome would do its function as well. But of course, clearly that is not sufficient enough because people still get infection. Breezy one says, yes, it's a tribe. Yes, it has become a very, what I am proud of is that our tribe is the most educated and most diverse. We have all kinds of folks here: maskers, anti-maskers, vaxxers, anti-vaxxers, young, old, various religious beliefs, no beliefs. And with all of that, we still manage to work together, study together, help each other, have fun sometimes, and we are a good tribe. We are very educated tribe. That day I was so cracking up when one of the cool bean caught Dr. Corey to say, "Hey, your study's p-value is 0.94. Why is this significant?" And he was cracking up on getting caught with that study. And this could only happen in this forum. The cool beans are very intellectually um, su- high and very well educated and informed as well. Yep, it's the same here. So you can tell me, you can actually tell it by this one, that my doctors, a bunch of cool bean doctors who've been talking with me through this time, have been telling me that those who think I have COVID, they've been saying, "You have COVID, you are not supposed to teach anymore. I don't want to see you teaching. I don't want to see you sitting here for 2 hours. I want you to lie down." And I just cannot stop myself. It would be so sad for me to actually not have this discussion. Louis says, how many time to update a vaccine to a new variant and distribute this? So if the vaccine efficacy goes below the expected efficacy, then they will have to update it. So give me 1 second. I think Luffy wants to go to the other room. Interestingly, it was not Luffy, it was Kyrie. James Mellis says, what do you think about JJ causing thrombosis and seizures? So, of course, I am quite concerned about that. What I wanted to do was, I wanted to um, look at this JJ's with others too, because in many cases they had said it's not related to vaccine. Although, when we looked at that data together, we saw that the thrombosis tendencies were more in the vaccine group, and placebo was zero. They still say this is not related, but I think it is related when it is only in the vaccine group. So I still want to do a comparison with the other vaccines to see, um, did this same thing happen in others as well. Andrew says, thank you so much for volunteering your time. It means so much. Absolutely. And I am so, do you know that whenever I am alone or sleeping at night, uh, I keep praying that we have reached this far and the end of the tunnel is a couple of more months. And so everyone stays safe during this time and we come out successfully on the other side. We have been journeying together for a year, and I hope we keep our guards up, we stay safe, and we come out successfully. That would be a huge win for us, all of us together. Absolutely. Scott TNYC says, Dr. Bean, hope you're feeling well and taking vitamins and ivermectin. Absolutely. You can tell this. So I have been talking today since 6 o'clock and it is 7:34, and I am still fine and energetic. Yesterday I was not that way. Yesterday, first I didn't want to even come out of my bed. And then when I was teaching, I was actually saying that, hey, I think I need to stop. So very different. And yes, I took ivermectin. Thank you very much. Papa says that, Dr. Bean, have you heard South Korea launches investing two deaths? No, I have not. I need to get myself acquainted again with the news that is going on. Michelle, was this your tweet yesterday that you're not a rhesus monkey and take your ivermectin stat, the nurse's order? Was this you? Your name here and on Twitter was the same, so I'm assuming it was you. That was so fun. Yes, but Luffy is my favorite as well. France is doing the best thing. Lazy Bean, smash that like button. Cheap gin will be in your future. Leave. Thank you, France. Fishtail, are you taking fluvoxamine? Not yet. So, fortunately, I did not have any brain fog issues. So, I'm not taking it. If I tell you personally, I don't think it is COVID, what I have. But half of the doctors I speak with, they say you have COVID, and half of them say, no, you don't have COVID. So I just manage it as if I have COVID. Bambi says, Dr. Bean, so sorry you have COVID. I hope you make a full recovery. Maybe you should listen to your doctors or listen to your body. Yes, so I have been taking medicines. They do want me to take rest. Yesterday was a day that I think that I should have rested. I wanted to have rest. My body was just not able to sustain. But today or the other days, I have been fine. Ivermectin makes a huge difference. James Mellis says, and Bambi, thank you so very much. James Mellis says that when would we have Novavax? I hope that in another month or so that they give us the results. So Rima says, is the iMath not iMath? No, so iMath is mostly in the hospital management. Although they do have outpatient, but they were not really that strong. Plus, they didn't have ivermectin in it that strongly. So iMath is mostly hospital. iMask is mostly oriented around ivermectin, and especially with prophylaxis. So what would you suggest as the best anti-COVID strategy for someone immunocompromised? Of course, the most important thing is to stay isolated and mask and social distancing and cleaning your hands and so on. So that is the most important part. Then is keeping your supplements. Of course, now with the kidney, the problem is the calcium imbalance or the vitamin D imbalances. So just make sure that you tightly control them, but with your doctor's help, because a renal somebody who's immunocompromised, let's say because of a transplant, and they do not have, I do not know how well the kidneys are functioning. So just be very, very careful around vitamin D levels, that they should be right levels, 40 nanogram and above. Then being immunocompromised itself is not an issue. Just have those preventative measures, which we all need to have. Actually, it is so difficult that those who have a strong immune system also have a chance of dying because their immune system can overwhelmingly respond. So there are risks on both ends. So there is a question, where is Dr. Syed? I hope you're asking about Dr. Syed Heather. I believe he is in New York, and he has a few states as well covered in that area, 25 or 26. Be curious. Cloudy anti-COVID strategy. So that's what we just talked about. Letitia says, Dr. Bean, tell us how many likes you have because we love you. So I have no idea. There are 500 people right now who are watching. I have no idea how many likes are on the video. Jody says, question, could your COVID strain, if you have, not be picked up by old tests? Could new strain need new tests? So yes, so one of the doctors who is practicing here in California, she said, hey, Dr. Bean, whatever I'm hearing from you, is the new California strain, and I'm seeing this very often in others as well. And she's saying that in this strain, I am seeing runny nose. In this strain, I am seeing low clinical toxicity. But she said that I do see some people having a faster deterioration. So this morning I spoke with her and she said, I'm very happy that you did not deteriorate fast. She said, normally what I'm seeing is somebody with this new strain, if they're going down, they go down very fast. And I want to touch wood. I don't want to say what she was saying, um, so that I don't jinx it. She was calling me a COVID warrior. She said, all of your symptoms are of COVID, and it is such a blessing that you did not decline and you are fine. So there are doctors who feel that I have a new variant. There are doctors who simply say that this is not COVID at all. A runny nose, the nasal areas, congestion, very mild sore throat, very mild myalgias, almost no fever, no lower respiratory tract infection signs, symptoms, no oxygen changes. They say that this may be just some other common cold. So, and on top of that, the test came back negative. So the whole thing is now a confusion. Teresa says, would it not be wise to give a first dose to all people to create a greater block against the virus? Yes, so that is what UK is doing as well. US is still saying we would keep both. I am a pro both. What baffles me is how come we are in a state that we do not have enough vaccines? We were told that in the first quarter we'll have 200 million doses, and then within the few more months we'll have 200 million more doses. And now we are just sitting here thinking we don't have enough doses. So that is what I'm more annoyed with. But let's say if we accept that fact that that is where we don't have enough doses, then yes, just give one dose to everyone and move forward. Excuse me. Texas says, hopefully great knowledge application with great nutrients, etc. works well. I hope so. I am still keeping my fingers crossed, as much as there are doctors who have already congratulated me and said, great job, you are doing good. So we are happy. And I am still nervous that if it is COVID, it can take a turn anytime. So Mercy says, Dr. Bean, has any one of your contacts gotten sick? So can I say it this way? There are two groups of my contacts. That includes my friends, family, even my medical students, and my professional friends, doctor friends. The most compliant group has been my medical students and the working doctors who were my students. They have been very compliant. They have used the prophylaxis that I've been giving. They have used ivermectin and other drugs. So over there, I haven't seen anyone getting sick with the ratio that I see in others. But I've seen some getting sick. And when I ask them that, hey, were you taking those? Many times they say no. The cool beans here, I wanted to ask here as well that has anyone who was taking prophylaxis regularly became severely ill? I think no one became that way. Then in my own folks, let's say friends, families who I can talk and call, and then colleague doctors, those who were not believers of the prophylaxis or ivermectins or hydroxys or zinc and thought these are just fads and these are just nothing, I see a lot of folks becoming severely ill. Even 3 or 4 deaths as well. But those who have been taking these prophylaxis, even if they catch COVID, I see usually they're coming out very easily with lesser symptoms and not becoming long haulers either. And I have seen some folks with comorbidities and advanced age that were practicing these things and just were saved. So touch wood that that stays. William says, if you had a guess, how do you think you got exposed to the virus? Um, Coffee, I think, because I don't do anything else. Um, Papa says, Saudi says all Muslims will need to have COVID vaccine before they can perform annual pilgrimage to Mecca. This is like a vaccine passport. This is not fair for people unable to get or take the vaccination. So vaccine passport is something that has been, there was a news here as well, and people were upset that why is there a vaccine passport? Fine, that is a different thing. But I think that if they're saying that, hey, only arrive here with the vaccine so that you don't get infected and you don't make others infected, I think that is fine. And that should be fine for any gathering, not just for Makkah. What's so bad about that? Sorry, Papa, you may feel that I am not going with your message here, but I am always on this side of protection. So Trevor is asking, will you get an antibody test? So that is the thing, that now I need to figure out, can I get my antibody test? Yes, or a second PCR test. Cindy, I've seen you after a long time. Were you able to get mycoplasma out of your system? Did the IgG titers finally drop? Um, Scott TNYC says, I took ivermectin 4 years ago. Account of a bad parasite, possibly bird mites. I had took second round and cured me. Very interesting. Luis says, how long does it take to update a vaccine if it is not effective for a new variant? So that is the thing. It is now a couple of days. Because the genetic material is available and the vaccine can be formed, the RNA, you just have to splice that RNA, new RNA for spike protein, and plop it in and done. So it's actually pretty simple. I think more tedious will be the batching of it and figuring out which batch has the new variant vaccine in it or not. So I was reading that I think it was Moderna who had said, we'll just create a cocktail. I thought that that is just a lazy way of working with it to say, you know what, we're just going to keep the old RNA in there and put the new RNA in there as well. And now it covers both. And now they don't have to keep track of one batch versus the other batch. This is possible. So Simple Garden, I have been thinking about that as well, that my wife had been going out as well. So maybe she picked it up from somewhere. Or yes, Starbucks. So, Connie, low dose steroids. So, my prescription of the low dose for my patients has always been um, the Delta Cortril. I give 5 milligram morning, lunch, evening, 2 days. So, 15 milligram for 2 days. Then, morning and lunch for 2 days. That is 10 milligram for 2 days. And then just morning for 2 days and stop. So, just 6 days, very tiny dose. That's what I do. Island Man has a, I love the mask in the picture. Do you love Luffy as much as we love you? Luffy is awesome. So Luffy has been sleeping with me for now last 3 days since I had been sick. He has this weird thing that if he is sick or if I am sick, he sleeps with me. If he's sick, he sleeps on my chest at night, and I can't even move. So did I answer your question? Of course, I think it's just a very interesting thing, the way Luffy and I have a bond. Coffee shop it is. Okay, cool. So how about we break for today over here, and then, so this is interesting, but people who recover from the virus should have natural immunity. That is correct. So somebody has recovered from the virus, they should simply be able to say that, hey, we were recovered. There should be some certificate, or they can do antibody test, and that should be fine. Yes, I agree with that part. Mikavelli says, are you in the basement? This is the lower side. It's not, we don't have basement here in California. When I was in Massachusetts, we used to have basements. So no, just the lower level. Linda says, I think you are a very nice and caring man who also listens. Thank you, Linda. So Rima says, why are doctors making them take vaccines? Rima, is that for, sorry, I just saw the question and then it went. Yes, so he is doing something. Yes, correct. Paul Borg says, night to you as well. Absolutely. So time to rest. So if you are okay, let's break for today. So please like, subscribe, and share. And there are 3 links in the description. One is to buy me coffees. The other one is to become my patron. And the third one is if you would like to just support this work in general. I think that this work is very useful for healthcare professionals in the future as well, because clear concepts allow them to be able to take care of their patients better. So if you would like to participate in that kind of help, then you can join hands with me as well. So thank you very much, and I would see you tomorrow.